Welcome everybody, my name is Tyler Wunderlich. I am one of your Caldwell County public health educators, and I am joined today by
Bree Flanagan. I'm one of the other health educators here at Caldwell County.
And we are here to talk to you today about our WIC program. Now, we couldn't get someone from WIC to join us. They're very busy taking care of you all, but they gave us some information that we can talk about with you so you can better understand what the WIC program is. So, Bree, why don't we go ahead and get started and just tell the people, what does WIC stand for?
Of course. So WIC stands for Women, Infants, and Children. Now that definition for who's eligible is a little bit broader than just women and children. It basically anyone who is pregnant or has a child under the age of 5, which includes grandparents raising their grandchildren, foster parents who have custody through the DSS, single dads. If you have a kid under 5, you are eligible to apply for this program.
And that's awesome, making sure that everyone has access to good, nutritious foods.
Absolutely.
And other things that children do need. So it's not just women, infants, and children. It does go a little bit broader. That's awesome.
Yeah, I love that.
Yeah. So we've covered who's eligible to apply and who can receive it. Let's talk a little bit about the formulas. And what we're talking about there is specifically breast milk formulas, things that are going to replace breast milk. For any different reason that you might need it, there are certain ones that are covered by WIC. So currently they say that they are contracted with Similac, which is a general formula, advanced, sensitive, and total comfort, and soy formula. So it's going to be good for most people, as we can tell there. That way it covers a lot of different things. If they have specific allergies and whatnot, hopefully they'll be able to use that one. And then it also talks about they have certain medical formulas that they can use, but those do need a specific prescription to be used and be given out from WIC.
Yeah, there's a lot of different options, which are great. Hopefully we can meet as many needs as possible. Now there are also some food packages available through WIC, and those are tailored for each participant. So the information on that is really going to be dependent on your needs, and that's something that you would have to talk to a nutritionist about.
Yeah, and they can talk to you about that kind of thing. We have nutritionists who are available in the WIC office. So let's move over to a different type of thing that they offer in there as well. They have breastfeeding support in office. I had not heard of that before I moved to Caldwell County, actually, and started working in the health department. So I thought that was a pretty cool thing because there are complications with breastfeeding. You know, there's a lot that goes into it between mother and baby and making sure that everything goes right. So having that support is a really big thing, and I think that's a really cool thing that is done here. Yeah,
absolutely. We definitely have a trained breastfeeding peer counselor on staff, as well as a designated breastfeeding expert. So you can sign up for the peer counselor program or have a phone call and support tailored to your specific breastfeeding needs. And we also offer educational materials as well to encourage breastfeeding in the community. So like Tyler said, we want to help as many people as we can. We want to meet your needs and give you the support that would really help you in your parenting journey.
And with that, let's talk about how people can get into WIC, how they get applied to it and everything. The best option is going to be just contacting the WIC office. And you can do that by calling 828-426-8407. And then an intake member will speak with you, set up an appointment for you, and they will get you into the office via that route. But one thing we need to talk about with getting into the office is what you need to bring with you, obviously.
Yes, of course. So what you should bring to your first appointment at WIC is proof of identification that has your current name and address on it, a Medicaid card or proof of income, and person/child wishing to participate in the program. And I think that about covers it, unless there's anything else that you know of that people should bring to their first appointment.
Off the top of my head, I do not think there is anything else I can think of. Like we said, these are the experts that we ask.
Yeah.
So if that's what they tell you to bring, that's what you got to have.
And if you have any other questions, just call that number that Tyler mentioned.
Exactly. They can answer. They can tell you if you need to bring anything extra for certain circumstances.
Absolutely.
Yeah. So let's talk a little bit about how WIC impacts the community. We've already kind of touched on that a little bit, talking about they give food programs, they give breastfeeding advice and peer counseling counseling on that. They give, just a lot of different things to different families depending on what you need. It supports community partners in building healthy relationships for sure, and making sure that they are encouraging healthy meals and connecting participants to food and community resources. So it's not just you're getting free food, it's not just you're talking to someone about your child's health, it's getting you in touch with different resources that can help you through the entire parenting journey.
Yeah, I think that's great. I don't have anything to add to that, just that we really want to help people be as healthy as possible, and especially during those early developmental years for kids, that's so important to have proper nutrition. So that's why we're here. Our WIC office is here to help with that.
Yeah, and just making sure, because a lot of people don't understand proper nutrition even just for themselves at times. So having someone who can talk to you about making healthy meals, not only for your kid, but for yourself at the same time. You can share those meals, because I've been told they have some pretty good recipes in there and some pretty good ideas.
Yeah,
so
absolutely.
making sure you're getting that extra support as an early parent is going to be phenomenal. I know a lot of parents with babies that are pretty tired right now.
Yes, it's definitely a lot of work, so we understand that.
So let them help you with it and take some of that burden off.
Yes, absolutely.
And then the last question we gave them is there anything new that WIC is offering? And I'll let you tackle that one.
Yeah, so they told us that the state has changed benefits, and kids can now get tuna, options for more fruits and vegetables versus just baby food to make your own, and a new system to better accommodate when making appointments. So just really trying to increase that flexibility, and again, just really tailor specific needs or specific resources to individual needs, because I think that that's really the most important thing, because everyone's so different. So I think that's awesome.
And especially trying to make sure that accommodating to get those appointments is going to be really big, because WIC is busy. You got to give them a little bit of grace, but they're going to get you in and they will see you.
Yes, they'll take great care of you. All right, I think that's pretty much everything that they wanted us to talk about. Again, if you guys have any questions, please feel free to give them a call at 828-426-8407, and they'll be happy to answer any questions that you have. So thank you for tuning in. Thank you, Tyler, for leading the session, and we'll see you next time.
See you all next time.